Hello, I'm Brian Ulery, the Chief Executive Officer of St. Clare's Health, and thank you for joining us for Let's Talk Health. Today I'm joined by Dr. Singh, our Corporate Medical Director for Psychiatric Programs and Services. Today we're going to discuss substance abuse and what patients can do to find a safe and reliable detox program. Welcome, Dr. Singh.
Well, thank you for having me today.
So, Dr. Singh, what exactly does St. Clare's Health provide for our patients?
That's a good question. St. Clare's has been a major, or perhaps one of the largest in the state of New Jersey, but definitely in North New Jersey, one of the largest healthcare systems for behavioral health. But what I would like to emphasize on today are the detoxification or substance use services that we have. Before we get into that, if I may, I just want to talk about the big picture as to how did we even end up being where we are today. Sadly enough, this is not new. I have seen the problem grow over the last decade, if not more. And it has happened for a variety of reasons. It started with perhaps some misuse of prescriptions, but then the availability, the accessibility to opiates such as heroin and more recently fentanyl just added to the problems. Further, in the healthcare system, we made accessibility so difficult that patients never found it easy to get the help they need. To top it all, we ran into the pandemic, which led for people to be more isolated. In short, it has been the perfect storm, because of which we see an uptick in substance use, which our community is struggling with. At St. Clare's, we offer an array of services, which I'll be glad to talk about.
So that array of services is both inpatient and outpatient?
You got it. Treatments for substance use typically tend to be on a spectrum. The first step is going to be to get them to a point where they are free of substances. In other words, we refer to it as detoxification services. But what is different about St. Clare's is that we focus on the fact that that is just the first step in the spectrum of services. So the entry point for people who are seeking substance use treatments would be to get them detoxification services. One may ask as to what is so unique about our detoxification services. I wish it could be as simple as you have a blood pressure problem and here is your pill for blood pressure. But detoxification services need to be done, first and foremost, initiated in a very narrow window. Because if you don't get the help people need at the right time, they are more likely than not to relapse again. So that's our first step. So we can talk a little bit more, if we may, as to what have we done to deal with that issue, and then I'll be happy to discuss in more detail as to why do we stand apart from some of the other services out there.
When a patient decides to reach out for detox services, how quickly can they be seen at St. Clare's?
Well, I take great pride in saying that we tackled that issue first and foremost by having a walk-in clinic. You do not need to set up an appointment. As the name suggests, you just walk in. So we have that service open at our Boonton campus. Next, we immediately get to the assessment part, and trust me when I say this, within 10 minutes, we are able to get you started with treatment many a times while you're still in the walk-in clinic. Ultimately, we do transfer you to our inpatient unit, but the treatment starts as early as you walk in.
Wow. So what can you expect after you've walked in and been initiated into the program?
So I think one of the key issues which people often ignore in detoxification treatments is that patients are coming from a place of feeling ashamed. People are coming from a place of being embarrassed. It's not easy to acknowledge that I have a problem, I own the problem, and I want to do something about it. To that effect, our detox programs are not a medication management kind of thing, that this is a prescription and here we go. We have a team of people, whether it's our social worker, whether it's our coordinator of care, whether it's our behavioral health counselor. Our focus, actually, our prescription is to treat people with respect, and there's going to be love, compassion at the start. Most importantly, we don't judge people. So that's the first step. The next is, it's not about getting to a place where detoxification is complete. It is more important what happens next. So our counselors, our social workers connect you with the next level of care. Earlier you were referring to inpatient versus outpatient, and that's exactly what we do. Once they're at that place, we connect them with our outpatient services where they can continue to get both medication-assisted treatments as well as learn coping skills. It is very important to focus that as part of our inpatient as well as outpatient programs, we heavily rely on groups because a lot of people connect with their peers, they talk about it, they learn in a very therapeutic environment, and that is the key to success.
What role do families play in the detox program?
So we involve and engage families as often as we can, because we do recognize that at the end of the day, people do not exist in silo. They have a family to go back to, they have a community, they're part of a community. Obviously, all of this is done with the consent of the individual, but you typically need the support of people who care for you, who love you, for treatment to be successful. This is where our counselors step in as well. Families and people also, more often than not, and that's true actually for healthcare, are often burdened by the cost and what's going to happen next. And it's very, very difficult to put ourselves in their shoes and think about the fact that while they're getting treatment, what if they're also wondering about how's it going to affect my wallet? And therefore, we try to take away that anxiety. I'm very, very, very proud in saying that we make the process, whether it's inpatient or outpatient, seamless. You have insurance, we take care of the problem. You are underinsured or uninsured, we take care of the problem. The treatments are not based on your insurance status. The treatments are based on your need.
And we get some of those financial assistance from the county and the state as well, is that correct?
That is absolutely true. Now, one may wonder as to why us, and that's because even the state, the county, they recognize the high quality care that we deliver. For people who are viewing this, I can say it with a lot of confidence, these are not words. Talk to other peers, other individuals who actually have undergone treatment or are in treatment in our programs, and I can say it with a lot of confidence, they will attest to what I just said.
You know, one of the things that other programs have are a number of patients who go back into to addiction after they go through detox. What are our statistics regarding that?
It's a great question. And I just want to be very clear. At the end of the day, we are appreciative, we are happy that there are other programs out there because we care about the community at large. So I'm glad that there are other programs out there which also attempt or are trying to help people. But it is absolutely true that St. Clare's is the leader. How do I know this? Whether it's a patient testimony, whether it's a relapse rate, which you were referring to, our numbers clearly indicate that we are a leader there because we follow up with our patients. We want to make sure they're in a safe place. We also recognize, however, Brian, to be very honest, we recognize that substance abuse in general is a relapsing and remitting problem, which in other words means patients do relapse. There is a biological reason behind it. But where we stand apart from many of other programs is that we don't judge them if they were to come back and say, well, we gave you the tools, why did you not follow? What we focus on is how can we tweak those tools? How can we make it more personalized for you? We sit together, try to figure out where did we fail so that the next time there is a longer period of sobriety.
One of the things that I've seen in our program since I've been here for the last few months is that the number of people that are involved in our programs have long tenures with the organization. How does that impact the programs that you manage?
Well, that's a great observation on your part. If I was to think about it, some of our psychiatrists have been here for 37, 38 years. Some of them are maybe about 20 years with us, and some of them recently joined. So we have a perfect blend of youth and experience in our team. Further, it's not only a team of psychiatrists, we have a team of medical doctors who want to make sure that you're medically doing okay. We also have social workers, we have counselors, we have peer advocates, you name it. It's a full array of services. But I do want to focus on something very important. Even yesterday, there was an individual seeking help. Our team has the expertise to quickly pick on the fact that the patient will get detoxification services better on the medical side because the medical parameters were such that it was just unsafe to do it on our typical unit. The reason I bring it up is because at the end of the day, we are driven by the fact of what is right for the patient, not necessarily what is right for us. And that's the quality of care that we are very happy to deliver.
And if they're not able to be done detoxed at Boonton, we also have a higher level of service available at Dover, is that correct?
That is correct. So we, without getting into the nuances of it, we have an array of services. And I just want to let the viewers know that at the end of the day, it is our job to get you to the right place so that we can offer you the services in a very safe and compassionate manner. We focus on the medical needs, and if that is the case, we can transfer or we can provide services where there is more oversight from a medical perspective. We can do it in a place which essentially is more focused on the detoxification protocols and programs. But I think it will be very important to mention we also are well aware of the fact that majority, if not all, individuals who are struggling with substance use issues are also struggling with mental health issues. So earlier you were asking me, why do we stand apart? This is also one of the reasons, because it's our team of both psychiatry as well as the medical folks who look at you as a whole person. It is not uncommon as people are getting their detoxification treatment, mental health issues come up, and we are there. We come to them to address those issues, which is possible just because it's not a single program or a program existing in silo. We are part of a huge system. So our job is to get the treatment done what is right for the patient.
Well, speaking of that, after they have successfully detoxed, what are their next steps?
So once they're successfully detoxed, we again have an array of services on the outpatient side. Our services are located in Denville, they are in Parsippany, and we offer what is typically in our lingo referred to as a chemical dependency intensive outpatient program. I know it sounds way too technical than it should be, but at the end of the day, what it means is that we recognize that from an inpatient level of care, where you were getting monitored 24/7, it will be too much to ask for if we were to say, now go to seeing a counselor once a month. So we provide for a step-down program. Now in that program, you continue to see a prescriber who's going to manage your medications. We offer medication-assisted treatments, which includes treatments for opiates, which has been the main focus of our discussion so far, but it's also true that we help people with alcohol use. We help people addicted to benzodiazepines, more commonly referred to as Xanax or other medications. So they get referred to that program where they get at least 3 times a week group counseling, they get individual therapy, and as I was mentioning earlier, they get their medications as well. But we don't stop there. We also recognize that at the end of the day, our goal is to maintain sobriety. So then we continue to work with them, connect them with other services out there, which could include provision of some home services if they need, connecting them with a mentor in the community. Substance use is a long problem, long process, but then so is the treatment.
Right. You know, it's clear that you are an expert in this field and you're incredibly engaged with this community. What makes working at St. Clare's and being a part of our behavioral health team the most significant for you?
That's a very good question. I think it's fundamentally, I've been at St. Clare's for close to 10 years now, and I've worked in other organizations, so I can speak to the fact that when you walk into St. Clare's, there is a different feel to it because it all comes down to what is the intent. Our intent is to focus towards recovery, to focus towards wellness. So instead of having a cookie cutter approach of this is the problem and this is the treatment, we take the approach of what steps can be done to keep you happy, to keep you safe, to make you productive. Like, for example, in our outpatient services, we also offer, believe it or not, career counseling. Like, how can we get them back into the community? We offer them housing assistance. So there's so much. So it's not stuck to a treatment per se. It also addresses a lot of psychosocial problems, which unfortunately a lot of people are struggling with. And that is what sets us apart because people start to feel that they are part of our community and we see them as part of our family.
Good. Is there anything else that you want to share today about our programs?
Well, I guess as a conclusive remark, I would just like to say, we are there for you. We will keep up with whatever your needs are. The question shouldn't be, does St. Clare's offer X, Y, or Z? We will do whatever needs to happen to keep our people safe. It is our responsibility as a major healthcare system to ensure everyone's wellness, and we take pride in the fact that we deliver.
Well, Dr. Singh, thank you so much for your time today. And for those of you who've watched this video, if you need any additional information, please go to stclares.com and obviously follow us on Instagram and our Facebook page as well. Thank you so much for watching, and until the next time, I'm Brian Ulery, and I look forward to seeing you again soon.